Does putting warm compresses on eyelids after Asian eyelid surgery mess up the inner dissolvable stitches and crease line? I noticed that when I put warm compresses on my eyelids and on my sinuses above my eyes due to sinus congestion, it made the dissolvable inner stitches become more raised, prominent, and are above the crease line. I don't know if this is a coincidence or not, because I wasn't paying a lot of attention to how my eyelid creases looked right before the warm compresses. Is this caused by the warm compresses? Did it mess up my eyelids, cause permanent damage, and change the shape and crease line?
Thank you for your question. You're asking if warm compresses after Asian eyelid surgery can dissolve sutures. And even though you didn't submit a photo, I think that clearly you're concerned about the possibility of undoing part of your procedure by doing warm compresses. Well, I can certainly give you some guidance as to how to handle your postoperative care. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. Asian eyelid surgery is an area of focus and expertise in my practice, and I can give you a little bit of guidance on how I instruct my patients as to how to take care of their eyes after surgery. So to begin with, let's start with what are the intentions after surgery. When we do a procedure, whether it's a non-incisional or an incisional Asian eyelid surgery, the goal is still to bring the skin together with the muscle called the levator muscle in a way that creates a crease. Now, after surgery, regardless of any type of surgery, there is an initial 24 to 48 hours where there is swelling as a response to the trauma of surgery. And during that time, we generally recommend cold compresses. And we recommend cold compresses like on a schedule, like 20 minutes on, 20 minutes off while awake. Beyond that 48 hours, there is another phase where the fluid can actually be impeded by putting cold, and rather we tell patients to first walk, talk, move, basically get some movement, and if they're more sedentary, then they can consider putting warm compresses. And the goal is to help the circulation along in that area to help clear out the fluid. Now, everyone's in a hurry these days, but the reality is that surgical healing goes through certain strict phases of healing, of wound healing. And so you can't necessarily rush things along, but you can facilitate. So to answer the question about the sutures that are dissolvable for Asian eyelid surgery, in my practice, when I place sutures, when it's a non-incisional procedure, I usually use non-absorbable sutures. And if it's an incisional procedure, I also use non-absorbable, but I end up taking out those stitches in about a week. Now, in some situations, there is a merit to using an absorbable suture for anchoring of the skin to the backbone of the eyelid or to the levator muscle. And those sutures dissolve based on the body's own breakdown processes that are more in a chemical, enzymatic nature. So it's not likely that the warm compresses would undo or facilitate the breakdown, but it might be your physician's intention to use the warm compresses to at least accelerate circulation to the area so that your healing can improve. So that being said, talk to your doctor about this concern you have and understand that it's most likely that the procedure recommendation of warm compresses has to do more with facilitating of healing in terms of swelling rather than anything to do directly with the sutures. Now, again, this is in the absence of a photo and a more detailed description, but hopefully the general rules of thumb in the way we practice has helped you understand what you're going through right now. So I hope that was helpful. I wish you the best of luck. Thank you for your question.